Hi, I'm Marla with Clinical Cannabis Today, and we're here at the Patients Out of Time conference in Tucson. And I have one of my dear friends here with me today, Dr. Elaine Burns. She's founder and medical director of the Southwest Medical Marijuana Evaluation Center. And welcome. Hello.
Hi, Marla. How are you doing?
I'm doing well. Thank you for taking the time out today. We kind of wanted to just ask you some questions about what your thoughts are since we've had almost a year break, and what you've seen in the market from a business standpoint and from the medical standpoint. And maybe you can just kind of tell our viewers what's been going on.
Okay, so since we've had the moratorium on dispensaries, of course, we're not seeing as many patients as we thought we would see, simply because there aren't dispensaries. And so a lot of people have sort of been left to their own to get their medicine. As a physician, that's kind of a downside, because if I'm going to be making recommendations, or one of our physicians are making recommendations, we want a safe place for patients to go get their medicine. But in the past year, creative entrepreneurs have popped up, and there's caregiver collectives and compassion clubs, or patients can grow for themselves. So one of the, even though as a physician can't get involved in the medical part of it, it's very difficult. We've got our hands tied where we can't, tell people where to go to get their medicine. So that's been a downside. A positive has been that it's given us a little bit of time to get our infrastructure in place, understand the law, how it applies from a physician standpoint, and making sure that we're not doing anything that would put our patients at risk or our physicians at risk, and make sure that we're following the law to the T, crossing our T's and dotting our I's. So it's given us that opportunity. And the other thing that we've seen happen is a lot of people came in from other states who wanted to, I don't know their intention, so I can't speak specifically, but maybe make, from an economic standpoint, and make a quick buck on the industry, who have left because of the moratorium. And so now you've got the long-standing survivors that are left, I think, that have built their infrastructure, so now we can move forward, and the influx of patients will increase once they start to see that the applications are going to be accepted from the state, and they're going to be moving forward with the dispensaries. We'll start to see people come out of the woodwork. In addition, we'll see people coming out of the woodwork because there is on the ballot, or there's going to be a hearing to add PTSD, post-traumatic stress disorder, as a qualifying list. And that will open it up to a lot of patients who don't have a co-qualifying condition and just have PTSD. If that's added as a qualifying condition, then those patients will be able to take advantage of the medicine.
Will those patients have to bring you their medical records from their general doctor on PTSD, or is that something that you can diagnose and then recommend?
Well, according to law, as a physician, we can diagnose conditions and make recommendations. In this particular case with PTSD, because it's such a complex disorder, I personally, and physicians in our medical center doing recommendations, want to see medical records not only from a lot of them are from the VA, simply because they're vets. So we look at their comprehensive records from the VA, or if they have any psychiatric records, and we want to bring that all together and look at everything comprehensive. So even though we could possibly make a diagnosis for another condition, not with the PTSD, because of the not comfortable doing that because of the psychological component to it. So we just like with any other condition, we want to see those medical records, and then we look at those medical records, and then we do our own health evaluation, intake, and general examination, and specific examinations to whatever condition it is, and then we'll either we'll confirm the diagnosis and see if they're eligible, or we feel that the medicine would be right for them.
Tell us and our viewers a little bit about the process if they do want to come in and get a recommendation. What is it that is the process that you have them do?
Well, the process is simple, but yet not so simple. Really what it requires, as I just mentioned, is the medical records. And so a patient will call us, or they'll contact us on our website, and we have a qualification form on the website, so they can go to our website to see if they would even qualify. And once they know that they will qualify, they'll be contacted from one of our staff who will follow up with them. But basically the bottom line is we need to see those medical records from within the last 12 months. Now, a lot of people don't, and then we review those medical records. Myself as a medical director will review them all, and then they'll make an appointment if they're pre-qualify. We try not to set appointments for people if we don't feel like they would be a good candidate for the medicine. So pretty much once they have their appointment, but it's always up to the recommending physician to make that final decision. And so as a medical director, I'll review them. They'll make their appointment. They come in and have their health evaluation with one of our doctors. and then the doctor will make that recommendation, and then they have to apply to the state for their medical marijuana card. And there are patients that we won't recommend for example, schizophrenia, pregnancy, breastfeeding, young, even though 18 and above is our general. We don't see people under the age of 18, but we're just kind of cautious about the younger population. And so we just take everyone a case-by-case basis. One of the things that's unique about our evaluation center, though, it's not just about giving a recommendation for a card. We also have other
Educational, and I think
educational things, but treatment is what I wanted to say. For pain management, for example, acupuncture, something that's called biopuncture, where we're using homeopathic to inject in the pain side, because most of the patients we see are in a chronic pain condition, or it might be a nutraceutical. Maybe if they're dealing with insomnia, we can add to what they're using with the cannabis, and maybe recommend some supplements or nutrients. So it's not just about getting the card, it's really about total wellness for that patient.
a holistic center, basically, you're offering. And I think you also sell products too, don't you?
Well, the products as in supplements, yeah, if it's appropriate, for example, what on a case-by-case basis.
And so can you tell me about the increase of patients you've seen you've been open now for 2 years, I think. 1 year, it's been one full year. And what's your projection? Did you hit your projection this year in patients, or do you see it's going to be rising?
Well, because of the moratorium, no, we did not hit our patient mark. We thought we would be much busier. The projection was 200,000, and we're at like 25,000 or something like that. So, no, we did not hit our projection, but as I said, I think that was a good thing, because that allowed us to really get our infrastructure and our processes in place so that we could provide a great service to the patients. But as with the application process moving forward now for dispensaries, and as I said, if they add PTSD, we'll start to see more patients and we will get busier.
Great. And you're also head of an association in Arizona, aren't you? Head of a group of naturopaths, or for women in naturopaths, is that correct?
No, what you might be thinking about is I did start last year was the Arizona Association of Medical Marijuana Physicians. And again, with the moratorium and people just kind of things started to peter out a bit, that we haven't really pushed forward in that, but I'd like to resurrect that again. I was just talking to some physicians about doing that. And the reason for doing that is to provide a standard of care and a quality of care that all the medical marijuana recommending physicians have that level of care. And so when a patient goes somewhere, if they go to a physician that's part of that association, they'll know there's a certain level of care they'll get, as opposed to minimalistic medicine that sometimes is being what's the word I want? Doctors that are practicing, minimalist medicine, where you just go in, you see the doc, he says okay, and they write you a certification and kind of more of a turnkey, versus really taking the time to do an in-depth patient evaluation, seeing if the medicine is really appropriate for that patient, and then and providing other treatment options for that patient.
Great. Okay. And then one other last question is that you've just opened up a new office on Cave Creek and Cactus. And can you tell our viewers how they can come and get an evaluation or contact you?
Okay, so the contact's very easily. We do have 2 locations, one in Scottsdale at Hayden and McDowell, and then one at Cave Creek and Cactus area. Basically, the best way to contact us and to start the process is to go to our website if they have access to the internet, and that's evaluationtoday.com. Otherwise, they can call the office. We have a main number, and then we just get them to the right location for their appointment. And
that number is?
480-656-2119.
Thanks so much, and thanks for watching. Thanks, Elaine.